When you say that something is endemic, it's a recognition that that virus is not going to leave the human population. It'll be with us for years and years and years to come.
Dr. Robert Schooley is a professor of medicine at UC San Diego. He says endemic means that we've reached a sort of balance between COVID cases, deaths, and hospitalizations.
A lot of people now have experience with it from either being infected or being vaccinated or both. As that happens, it makes it harder for the virus to come into a new population that have never seen the virus. So you see this kind of low level smoldering most of the time, unless we let our guard down and let all the immunity decline.
The governor says his endemic plan is due to come out sometime next week.
And in that endemic plan, I think we'll be able to answer many questions that a lot of you have about what world are we living in? Where are we going with this virus?
Newsom hinted that the plan allows for counties and cities to set their own rules based on local realities.
It's great to be in the situation we're in. It doesn't mean we're never going to need to be masked again or we're never going to need a vaccination again. It just means that we are in a situation where we don't think we're going to have as dramatic a surge as we've had in some of the past ones.
Schooley says the governor's endemic plan will likely include fewer mandates and more personal choice. He says we know how the virus spreads and what works to protect ourselves, but we'll still see outbreaks persist in certain areas.
Periodically, when it finds a pocket of people who aren't immunized or who have low levels of immunity, you'll see a localized outbreak.
The governor says his endemic plan will include a blueprint for what could trigger a more aggressive pandemic response, like a more contagious variant. San Diego and California are seeing cases and hospitalizations fall, but that's not true of the entire country. Matt Hoffman, KPBS News.